When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
As leadership works around the clock to manage this recent health pandemic, our realities have shifted from routine to vagueness. Leadership's efforts to contain this pandemic while also trying to save the population's livelihoods have, however, emerged with them a lot of uncertainty, leaving many wondering, what's next? The business, the corporate, and the economic environments are riddled with so much insecurity at this time. A lot of establishments in the country are now full of empty shelves with no stock to move. Borders being closed have now shut all routes to replenish supplies for sale. A new normal has presented itself, but it has caused so much disturbance due to its ever-changing nature. New regulations, lockdowns, guidelines announcements have caused major disruptions in the way entities are run, which make for inconsistent flow of work. As people inconsistently work within this new normal, the question of job security arises. The question of, will my business survive these hardships, arises. Pondering on the issue can be so exacerbated that some people can have an anxiety disorder over the whole matter, a mental illness that causes feelings of worry, nervousness, or unease about something with an uncertain outcome. But as working professionals and business people who have to work at their optimum physically and emotionally and in fact mentally, what would the effects of having anxiety be for the workplace and indeed the business? How can people adjust to uncertainty to manage their anxiety? Dr. Kiran Bhagat shares his thoughts.
From a workplace space perspective, re-engagement with the organization that the employee works with has major consequences. In our industry, for example, we'd have to deal with ancillary medical staff, the nursing staff, the dental technicians, the cleaners within the hospital or the clinic or the health facility, the exposure or fear that they have of intermingling with patients possibly infected or carrying the virus. These are anxieties and fears that have to be dealt with from a medical perspective, but also from an organizational perspective as to how they deal with their employees as they return to work.
How can leadership in workspaces be supportive to ensure the mental well-being of their staff?
From the perspective of re-employment or going back to work, the employer will need to consider the social needs and education of their employee, the changes that occur within the workplace in terms of greater distancing and personal interaction, and that the idea that reality in future as an employer and an employee will be entirely different. An industrial or institutional perspective or community level, social support resources will need to be allocated both in terms of governmental as well as private institutions for workplace assistance, who are often conflicted in terms of how they will work within the original workspace. Whilst it may be difficult for an employer to take cognizance of the fact that the psychological outcome of the pandemic will have an impact on the workplace, consideration and understanding needs to be put in place, both in terms of managing the depression, anxiety and stress that has occurred during the shutdown, as well as the consequences that may occur and the appearance of new anxiety, particularly within the workplace.
What would happen if the anxiety is not dealt with or addressed?
The public are arriving from home. If we just take three examples, the medical industry, the educational section, and the restaurant industry, If we take the medical industry, there are nurse assistants, there are dental assistants who often assist the dentist or the doctor or the specialist that go home following a full day within their medical or dental facility. Their fear and anxiety about taking anything that they may be transmitting during the course of their day back home results in worsening anxiety, worsening fear, and possible absenteeism. This is particularly true if they feel uneasy about the lack of appropriate protective gear, the lack of appropriate cleanliness or sanitization, and indeed the fear that they work within a high-risk group. Within the educational industry, the same applies in the primary, secondary, and tertiary level, where teachers and lecturers are providing courses to children and adults of different ages and then going home with the fear and anxiety that they may be having exposed themselves to large numbers of preschool, primary, secondary or tertiary level students and going back into an environment carrying what they may fear, maybe the virus, into the home environment. So these are important issues in terms of the consequences of not providing appropriate psychological screening, protective and counseling avenues within the workplace. There is also the issue which beckons on public health policy in terms of the coronavirus itself. This is, for us in the medical industry, a young virus. We are not sure yet 100% about its transmission, about how long it lasts, and with the advent in the distant, not near future of a vaccine, how effective the vaccine will be. We also are unclear at present, given the lack of substantial research, on the prevention of transmission following exposure or potential exposure. What should we be using as prophylaxis? How effective will the vaccine be? And the current drugs, for example, the one that is bandied around, which is called hydroxychloroquine, has still not been substantiated in terms of its effectiveness in managing the coronavirus. So these are all issues that are new to most of us, both within the medical industry as well as in the workplace. Lastly, it's worth mentioning that many of the deaths that occurred in North America and in Europe in patients who were infected with corona occurred in those with pre-existing conditions: hypertension, obesity, diabetes, immunosuppression as a result of cancer or HIV, etc. And we have all the same conditions in this country. So those that go within the workplace with pre-existing conditions are already aware of their heightened risk for contracting COVID, and therefore counseling has to occur in those with pre-existing disease in terms of possible extra protection and care when interacting with the public.
Before we part, let us be encouraged to practice impeccable hygiene habits during this wave of the coronavirus epidemic. Wash your hands for at least 20 seconds and disinfect all surface areas in your homes, workplaces and any other places frequently. Reduce unnecessary travels and contact. With that, we have come to the end of our program. Until next week, keep safe and have a pleasant evening. Good night. This program was brought to you in association with First National Bank of Botswana.
FNB, how can we help you?